Welcome to Community Health Matters. I'm your host, Amy Marsalis. Today on our show, we'll hear about the potential impact of health care reform on Tennessee children, student nutrition, and a new online resource to connect people to care. All of that coming up next on Community Health Matters. From the News Channel 5 network, this is Community Health Matters, sponsored by the United Health Foundation. And Dr. Deanna Bell is my first guest today, and we're tackling a really complex issue. We appreciate you coming in to discuss this and its relevancy to the children of our state. We're talking about the Affordable Care Act, and there's so much attention on this. Obviously, it is extremely timely in our nation's capital as the debate continues. What is the American Academy of Pediatrics most concerned about within the context of this very important debate in our country?
You're right. It is a very important debate right now. Really, as the voice of Tennessee's pediatricians, the American Academy of Pediatrics is most concerned about the impact the changes in our healthcare financing could have on the children of our state. Of particular importance to us are the cuts that have been proposed for the Tennessee Medicaid program. Right now we're at an all-time high in terms of the rates of children's health care coverage in Tennessee. 96% of children in Tennessee have some form of health care coverage or health care insurance right now. And we really don't want to see those rates drop. And we're very concerned that the proposed cuts to Medicaid could result in a lot of children losing their health care insurance.
So can you tell us a little bit about why Medicaid and the Children's Health Insurance Program, which we know is TennCare and Cover Kids here in our state, why those programs are so important to the kids?
These programs are absolutely vital to the children in Tennessee. There are 870,000 children in Tennessee who are covered by Medicaid.
Wow.
And there are 100,000 who are covered by Cover Kids. So TennCare and Cover Kids together insure nearly 1 million children in Tennessee. This includes half of the kids in Tennessee who are under 5 years of age. It includes half of the children in Tennessee who have some sort of chronic health condition like cystic fibrosis, cancer, sickle cell anemia. And it includes 75% of the children in Tennessee who are at or near the poverty level. So these services are absolutely vital to their coverage. And as we know, developmental problems and different diseases are treated best if they're detected early.
Early intervention.
Right. Early intervention is essential. And these programs provide comprehensive health screenings, physical exams, developmental screenings, vision and hearing screenings, dental screenings, to help detect those problems in children. And when a problem is detected, these programs pay for the medically necessary services to treat the children. So they're absolutely essential to the care of the kids.
Treating them early, getting them on the right track, preventing more serious issues down the line potentially.
Exactly. And it's been shown that these children end up having fewer days out of school. They're more likely to graduate from high school, graduate from college, have better, higher paying jobs that pay taxes back into our system. So really, Medicaid and CHIP, or TennCare and Cover Kids, they don't just treat the problem of today, but they really invest in the productivity and the health of our population years down the road.
All right, obviously covering these kids and vulnerable populations is important, but there are also the budgetary concerns and the impact from covering large numbers of these children. Why are these cuts unnecessary?
Well, right now, Medicaid is set up in Tennessee such that the federal government and the state government both contribute funds based on the number of people who need coverage and what it takes, how much it costs to cover them, how much their health care costs. Right now, the federal government contributes about $2 billion to the coverage of Medicaid patients in Tennessee, which is about half of what Tennessee receives from the federal government in total. So with the proposed Medicaid cuts, or really it's a cap, with the new legislation, they're proposing a cap, which would say, okay, Tennessee, you've got a certain amount of money to cover all the people who need to be covered, and there's no additional funding based on the number of people who need coverage. And historically, when we've seen this done in other states, the states typically have changed the eligibility requirements such that fewer people are covered. They don't make up those funds from other places. They typically cut the eligibility requirements. And so fewer people are ultimately covered. And that's a big deal because half the people on Medicaid in Tennessee are children. And so if they change the eligibility requirements, a lot of children will lose their health care insurance, which is sad because even though they make up half of the Medicaid population, they only take 20% of the Medicaid resources.
Interesting.
So they're a relatively inexpensive body of people to cover.
I see, okay. So what happens if the cuts go through? What can the state of Tennessee do?
Well, like I said, most likely they would change the eligibility requirements.
Okay.
That's by far what most states have done. But it would probably also lead to an increase in taxes, or they could pull funding away from other programs such as education, public safety, or public infrastructure. And that's typically what other states have done before when they've gone to a cap system.
So why should employers or Tennesseans not covered by Medicaid care about these cuts,
Well,
in your opinion?
This is a problem for all of us to address. When people are uninsured, they don't receive their preventative health services, and so problems are detected later when they're more expensive to cover, and people generally seek their health care through the emergency room, which is more expensive. And that in turn places the burden of the cost of insurance or cost of care to employers and to people who have private insurance, families who have private insurance. So really cutting Medicaid is a short-term solution to a long-term problem.
All right, well, thank you so much for shedding light on this very complex issue and speaking on behalf of the organization.
Thank you so much for having me.
All right. Enjoy the rest of your summer.
All right, you too.
Thank you. And we'll be back with much more of our program right after this.